Hello and welcome to another episode of Teaching Heroes, the teaching podcast where I ask teachers and educators what does it take to turn up every day and teach tomorrow's leaders. And today is another really exciting episode in my what is going on with this COVID-19 pandemic and its impact on health and education. And I have an absolutely incredible guest on today, Associate Professor Faye McMillian. Thank you so much for coming onto the podcast.
Thanks for having me, Jo.
Your colleague and my fellow COVID-19 pal, Ben Harris-Broxis, recommended you. And when I Googled you, I was like, oh my goodness, this woman is incredible. You were a member of the Order of Australia this year for your services to Indigenous and rural health. You are one of the Deputy National Rural Health Commissioners today. You were New South Wales Aboriginal of the Year in 2019, and that's only the beginning. So thank you. I really appreciate you coming on today and talking about the impact of the COVID-19 pandemic on Indigenous and Aboriginal populations and our rural populations, because it's a really important part of the conversation.
Thanks for having me, Jo. And yeah, Google can overinflate, so happy to be part of conversations. So thanks to Ben and to yourself for reaching out.
Yeah, it's great. So can you tell us a bit about your background then? So you started as a pharmacist, is that, but I'm sure, there's a long history before that as well.
Yes and no. A long history. I actually started in the pharmacy industry as a shop assistant. So so I'd worked for a number of years. Long story short, thought the pharmacist was being paid a truckload more than I was, and I was essentially doing his job. So at 27, I decided to make an application to go to university to study pharmacy, and it put me on the journey that has brought me here. I actually say I'm an accidental academic. I didn't go in thinking this was going to play out, and so I am still a community pharmacist. I actually still work here in my local pharmacy in Coolaman, where I live and work in Wiradjuri country. So I'm fortunate to live and predominantly work in my own nation, so which is a wonderful thing for me. Allows me to stay connected to country and connected to my ancestral roots, but it also means that I can actually stay connected to the other activities, which is, as one of the two Deputy National Rural Health Commissioners, being able to live and work in rural Australia is a really credible point of difference that allows people to have faith and a level of authenticity to the narrative that you do bring. So, I started out at 27 and graduated when I turned in my 30s. Now that we've established that, we won't talk about age beyond that. But it started that in that process, we found out that I was going to be the first Western trained pharmacist who was Aboriginal. So I do want to state, though, that in all things that Aboriginal and Torres Strait Islander people were practicing pharmacy long before Western society practiced pharmacy, and nor was it taught in the way that we understand pharmacy practice now, which is probably one of the unique opportunities that I'm able to marry both of the worlds that I work in, which is as a pharmacist and an academic, but also applying the lens of my lived experience as a Wiradjuri woman. So, started off doing community pharmacy, was some amazing experiences, being able to work in very remote communities across Australia, as well as I had the opportunity to go and work with First Nations communities in Canada in my training. So trying to look at what are the things that impact First Nations people globally, and what are the things that we can do. So as I said, accidental, but it started a journey where, I've been able to connect through my own lived experiences and trying to find other like-minded people in that. So part of that was the establishment of Indigenous Allied Health Australia. So as a founding member of IHA, that started off with 7 Aboriginal and Torres Strait Islander peoples from diverse backgrounds, not just in nations backgrounds, but in professional backgrounds, coming together and go, how do we actually envisage professions that are inclusive of Aboriginal and Torres Strait Islander peoples and the knowledge systems that they bring to the professions. And then, IHA is one of the peak organisations today. And that led to, I suppose, a number of things starting in the academy, and the different experiences that I've been able to have across that. So, being fortunate to now be a lifelong fellow of the Atlantic Fellows of Social Equity here in Australia, that's linked to the Atlantic Institute, that links all of the Atlantic Fellows from across the globe that are working in other areas, from anywhere from brain health to racial and social equity, racism, health infrastructures across Vietnam, and understanding what do we do and how do we bring it all together.
Yeah. Wow, that's incredible. And managing those two, as you say, Western knowledges and your Aboriginal Indigenous knowledge as well. How was that at university? That must have been quite jarring at times.
It was.
Were they often in conflict, or was there could you see connection as well?
Creating connections through, I suppose, using a different lens to apply knowledge is one way. And yes, it was jarring, and it still is. I often talk about the brain-acquired head injury that, Aboriginal and Torres Strait Islander academics in the academy in this country, and then indeed First Nations people across the globe, that we hear about decolonising truth, talking truth back to power and things like that, that it is still a struggle. Well, Professor Larissa Berendt wrote the Berendt Report in 2012 that spoke to the need for the academies to do differently, to recognise the space and place of Aboriginal and Torres Strait Islander peoples and knowledge systems into the academy, and how that could actually then transform lives. And that was in 2012. It's still very much a talking point, and I follow a lot of other Aboriginal and Torres Strait Islander academics and chat to them as well, and it's something that we're still talking about today. Professor Chelsea Watago just released a book, Another Day in the Colony, about her experiences. And, for a lot of Aboriginal and Torres Strait Islander peoples, there are similarities in those experiences, as well as similarities of the experiences of racism. And that's what it is. A lot of it sometimes is unintentional, I will grant that. But then there is a lot that it's like, oh, this is tradition, we can't change tradition. And then you go, well, if tradition's just based on age and you've done that for a couple of centuries, let's go back to the oldest surviving culture in the world and say, oh, tradition. So it is still a struggle, but you find allies and champions, those that are willing. Ben, for an example, that goes, where is the voice? And I don't want to speak on it, so I'm going to pass it to, an Aboriginal and Torres Strait Islander colleague that I know can speak to it. And that's the champion. They're the champions that we need, that realise that their own egos aren't going to be dented by the fact that they can walk alongside and share in a journey, because they're open to it. So you could get me going all day, and I'll try not to.
Maybe on another episode, but it'd be great. There's so many questions there, but I kind of want to go to March 2020, then when the COVID-19 pandemic really hit Australia. And I can imagine there must have been a lot of angst in rural and in Indigenous and Aboriginal communities about what that would mean.
Yeah, look, I think what we'd learned from what's played out since is the very active involvement of Aboriginal and Torres Strait Islander peoples in the COVID response, and the great results that we were seeing probably up until just recently. I mean, you're looking at the cases in the Northern Territory at the moment, and things that you go, okay. So there was a lot of Indigenous-led and Indigenous-informed activity that was demonstrating great results for Aboriginal and Torres Strait Islander communities and other people that were living in the communities alongside of Aboriginal and Torres Strait Islander people. So, it wasn't just this is only to benefit Aboriginal and Torres Strait Islander peoples. This is, part of it was understanding the collectivism of, when you say you're a part of a community, we look after the community.
Yes.
So it gave us a moment to actually, I think, for the rest of Australia to see the staunchness, the ability for us to be able to do and plan and be successful, because we'd been doing it, but it was never in the spotlight. These activities were never there. And that, was a moment for, I suppose, governments across all levels of government, from, local through to state and territory, and certainly, the broader federal government, to start to pay attention to what was being said about, these are the approaches that you need to be mindful of, and how do we support that? And that showed that leadership. It showed that we had the capacity and we had the knowledge to drive those agendas. And as I said, did so extremely successfully.
Yeah.
But what we knew, because of the overburden of other disease states and things like that, was we needed to respond, and we needed to do it swiftly. We did need to respond to ensuring that our vulnerable communities were going to be as safe as we could humanly make them.
And I was really struck watching the different responses in America and Canada with their First Nations, and the devastating impact that COVID had on those communities there, and as you say, the incredible leadership shown in the communities in Aboriginal and Torres Strait Islander First Nations here. I mean, that must have been a source of both pride and also devastation for you, considering your work, your past work over there.
And look, yeah, it was. And I think what it showed, and is continuing to show, is that for a very wealthy nation, Australia still has some opportunities to look at how can we do better. And there were moments of things that we can learn from other nations, but it certainly brought forward the inequities that still exist in our health systems, and how we either put in long-term and sustainable measures to ensure that those inequities start to lessen and then not even exist.
Yes.
We still have to, as global citizens and other First Nations communities, respond to the pain and the trauma that is being felt elsewhere as well.
Yeah. Wow, that's incredible. Was there a consensus across the country in how to approach these communities, or was there was there any negotiating, or like did everyone kind of come together and to lead this response?
Look, yes, it was a unifying opportunity for people to come together and say, what we want at the centrality of this is people to be well. Yes. But what it did do was provide an opportunity for people who know their communities the best, who are actually in relationships with them, for a collective coming together and going, here's a toolkit, take what you need because you know your community. And so that was, I think, something that was slightly differently done, because what we've seen, obviously, historically, is that, here's something that's worked somewhere else, you take it and it'll work just as well for you, and if not, blah. So I think they're the bits that we had already learned from. But like every community, we're not homogenous.
No.
Every environment, listening to the podcast is with Ben and yourself, it's understanding that culture plays a very critical role in the understanding of how we respond to this. And so when we talk about the diversity of cultures, we have to recognise that there is the diversity of cultures within our Aboriginal and Torres Strait Islander cultures as well, and that has to be nuanced to the responses that we do.
Yeah. And the other thing I was wondering was how those, I mean, as you know, obviously a diverse response from across the country, but considering the history of government intervention, devastating history of government intervention in Australia to First Nations, was there any pushback or reluctance across the country to, because, you know, I kind of look at the vaccine protesters, you know, particularly in Victoria, decrying their freedoms, and I'm like, well, you know, this is the first time this has happened to you, but we have a history of it, a long history of it. So I can imagine that understandably there would have been some reluctance, suspicion around some of the, you know, government rules as well.
I think, again, what it demonstrates to everyday Australians is the generosity of Aboriginal and Torres Strait Islander peoples to say, okay, we're going to do what's best for our mob first and foremost. You know, all politics aside, if we need to take from this, take from that, we're going to do that. What we'll do afterwards is sit down and go, okay, what have we learned from this? And I think that's what history, you know, since colonisation has shown for many Australians, if they care to look, is the generosity of Aboriginal and Torres Strait Islander peoples to actually genuinely want to be in relationships that will create that, you know, ongoing and sustained community connections that allow for, you know, every human to flourish. So, yes, there were moments, and look, you know, what we had was our leaders in those moments taking them when they were appropriate. But when it was boots on the ground, we need this to be action, we need to galvanise this. There was none of that. You know, there was no bickering. There was no, how do we make this a point of actually trying to reiterate that, you know what, you probably could do a better job as we move into the future. But in the moment, it was, what do we need to do? What does this need to look like for our communities so that we actually are able to have our generational conversations between our elders, our youth, that can continue and sustain. And we didn't have the moment to go, you know, this is our time to stand on the platform and
And the impact, so in that, I also wonder, particularly in rural communities, that there was a real awakening, I think, across the, you know, looking at the New South Wales looking in New South Wales, a real kind of perspective of the differences in access to health services in rural and regional communities in New South Wales compared to the city, and that there was a real response with, well, we've got to kind of keep COVID in the city because this is where the concentration of services are, and we don't have them as much out in the state. And to me, I get that that's appropriate, but also part of me is like, well, why? You know, this isn't the way to run a health service. We can't have them all kind of concentrated in the city. What is missing? How come we can't act, you know, how come we can't respond appropriately to a pandemic in rural and regional areas?
Yeah, and I think they're the lessons that have been learned, which is, you know, again, as a society, we can't rely on the fact that if you live and work in rural and remote Australia, that you will go to the cities or the larger centres to receive care that you should rightfully have as any Australian citizen or a human being, you know, under the rights of the human rights of right to health. So they were critical, again, in highlighting, and it was also critical to highlight, I suppose, the relationship that does that exists between rural and remote and metropolitan areas, that we are actually in a relationship together. So, you know, when you impact one, it impacts on the other. So we have to try and say, what's the impact going to be? Is it positive? Is it negative? And look, crystal ball would mean if we had our chance again, we might do things differently. I genuinely would like to hope that we would. But the thing was, nobody knew. That was, you know, we had such a small population of that generational knowledge that knew what a pandemic felt like, but never in the environment that it existed today. Like, you know, the ability to move around, well, not even just the state, you know, prior to the shutting of the borders, you know, people would jump on a plane and go to Aotearoa for a weekend, or, you know, it was not, we didn't put the same, I suppose, privilege that we would once have done. So there was a lot of generational learning that needed to take place to understand, well, even looking back at the history books of how did we respond to the last pandemic in this country, so much has changed. And our ability to connect via even these mechanisms. And the way we globally shared information that provided opportunities to progress activities that, yes, once would have taken much longer, or that it was the moment that we realised that we were truly all in this together. You know, it sounds a little kumbaya, but, you know, I think that there was that genuine thought by the majority of people that this is a human crisis. It's not an Australian crisis, or it's not just, you know, crisis in small towns. This is a crisis of a global proportion. Along the way, I think we lost some of our equity groups that really needed us to focus on. But in saying that, you know, I think, as you said, what we wanted people to understand was that we are in this, you know, as I said, kumbaya, but, you know, in this together, and that there was genuine sense of empathy and understanding around when people were being traumatized and people were being fatigued. And it's like we had no preparation for it. It's unlike, you know, unlike preparing for war, where you know that you'll send this wave first and then you've got this, you know, the backup that's going to come in when they're fatigued. We didn't have that. So, you know, what we had was people who were fatigued, working in fatigue, that were just continuing to be fatigued. And then I don't even know that there's a word beyond, you know, you would just rat shit. You know, that it just, the psychological human cost is yet to be explored.
I agree. I agree. And I think, you know, you're right. It's a bit like we're treading water in a sense, because we're still working out the physical impact and wondering, you know, the pandemic's not over yet. There's quite a number of countries worldwide who aren't vaccinated. What does that mean for variations of the virus? And then that impact on Australia as we open up. So we are kind of treading water, and the impact on mental health services, I think, is not being talked about enough, in my opinion.
Well, I think we didn't talk about mental health enough, in my opinion, prior to the pandemic.
Very good point.
That, you know, again, we're now playing catch up and we're talking about it, but not at the levels that, you know, address what was happening prior to the pandemic and the issues that were contributing to mental unwellness. And then the issues that will continue to play out as we understand the impact of the pandemic on generations. You know, I'm a mum of 13 and 14-year-old, I'll put them kindly, you know, children that are surviving in my house. But, you know, they're asking questions and I've got no answers except for try and reassure them. But in that, you know, I'm still confused, I'm still unsure. And so, you know, we don't have, but all we have is the optimism that collectively, if we do this and you look at, you know, the people with, and not just academics, you know, I talk about the intelligence of our communities that, you know, you don't need a degree to, you know, be, you know, and extremely, you know, switched on and, you know, contributing and doing all of those things, that when we harness that, that the opportunity to move forward in leaps and bounds can be, you know, it can be envisaged and then realised. Whereas if we sort of still ask people to try and do this on your own, chip away, try and respond to what you can when you can, that we'll lose good people along the way because of that fatigue.
I have been really galvanised by the community response. Living in Western Sydney, it's just been incredible to watch and be a part of that, collective, just really getting on with it, and how can we come together, and how can we, move us forward through this crisis, and same with in Aboriginal communities and rural communities, the way everyone just banded together to say, even though we're all stuck at home by ourselves, that community response is it's just inspiring, and I hope that we kind of keep going with it.
And it allowed, I think prior to the pandemic, there was a lot of conversation around the generational disconnect. It actually brought generations back together around, well, if Nan or, Nini didn't know how to FaceTime or connect on Messenger, there was those within their family circles and structures that could see them that were going, let's ring them, let's connect you back with the people that you need to see and hear from. You may not be able to physically connect them, but you can create that psychological connection. And I think that generational, gap between the digital native, the kids that have got their phones in their hand 24/7 almost, to connecting generations of other people with the platforms that we didn't know. Or so, as I said, there's been some exceptionally positive things that have come out of this.
And with that technology, like telehealth, I know that has been a real, just from a working mother point of view, to be able to call the doctor, not having to physically go in, but to call has been amazing, and also being able to access mental health counselling and psychological online. My family has embraced that and taken that up, and it's been actually quite effective. And I hope now it's kind of this response of, they just pushed it back for so long, telehealth, and then when it just was the only option, I think hopefully now saying, it does work. It might not work for everything, but it can kind of work for quite a lot of people, just being able to call your doctor on the phone or have a Zoom chat or
I agree. It's not the panacea to fixing particularly discrepancies in rural and remote communities too, with access to services, but it's certainly highlighted that we can actually use them more effectively to engage and keep people connected through a variety of spaces. But it also meant that we were more open to looking at what are the other services that we can potentially deliver through this platform that allows people to still feel safe and connected. And as I said, and I think we've all learned as we've come, on this journey in the pandemic, that it never actually replaces that face-to-face opportunity, but it does give a sense of connectedness that even just through a telephone could have been, diminished. So that was something that I think we have learnt from, and that there are conversations across multitude of, service providers and different professions saying to government and, irrespective of who is in, that we do actually have a great opportunity. Let's work out what were the really good parts to it, and then what were the parts that we could modify or adapt to go, how do we make it better for the future? So they're the parts that you just go, okay, what can we learn?
And university education, I think what really highlighted was that students do want to come on campus. They do want to meet their friends and meet people face to face, but also that some can go online, and how does good quality online teaching work? So I think that's been a really great outcome, that we can now say, as a drama teacher, it's been very difficult to teach drama online, and I can't wait to get back in the rehearsal room. But but you can do both, And I think that's been, but it is essential to kind of come together when you can.
Yeah, and I think, you know, some institutions have taken it as a real learning.
Yeah.
Okay, what can I do? Others, I think, you know, again, as we progress, and I suppose the other thing has been the support of the higher education sector to continue to deliver educational opportunities that, you know, it wasn't the first thought. You know, we're not a health provider, so, you know, we've got to tunnel our resources. And let's face it, also a number of resources that were at institutions were used to respond to the pandemic. So we've got moments to, again, a bit like what I was just saying about telehealth, to go, okay, what are the bits that really worked, and how do we recognise place-based learning? And how do we recognise what are the things that we can do effectively, and then maximise those opportunities when we come together to be really connected, to be really working in a space that goes, okay, let's use every moment of being physically together to get the bits that we'll need to sustain us when we go back to doing the online stuff.
Can we talk about the vaccine response now in terms of the vaccine take-up in Aboriginal and Torres Strait Islander communities and how that was managed? Because it seemed, you know, that was a real, I've been quite supportive of the New South Wales public health response generally, but it seemed to be a mismatch, you know, from an outsider looking in, seemed to be a gap there that while, you know, those communities were should have been in the first vaccine rollout, it seemed to have not translated to actually, you know, vaccinations by those who chose to in communities. So can you speak to what actually happened there? What was missing there in the public health response?
Look, I think some of it was, as you say, that inability of we didn't know what we didn't know. And that, okay, how does this look? And it was, part of it was, oh, well, we know potentially how to respond to large urban areas, how to get stuff there. If we until we can get vaccines there. And I think they're the bits that were the challenge, because let's face it, Western Sydney has one of the largest Aboriginal and Torres Strait Islander populations in the country, actually. So, you know, when we talk about the response, it was needing to be responded to in varied, nuanced ways. And what we had to start with was obviously, you know, we started with AstraZeneca, and that required a particular, you know, cold chain storage and all of those things that the infrastructure existed in large places. And how did we get those out, you know, being mindful of cost and all of those sorts of things, that became a challenge. So, you know, consideration of, you know, how do we do things in combination to try and ensure that. I think there was some confusion around who was leading what and where people were getting their information, you know, who were their trusted sources. You know, some were listening to the federal government response, and again, you know, and sorry, you know, that everybody was doing what they thought they should do instead of going, well, okay, let's just a moment, but in that moment, what did we, you know, what were we going to lose? So it was a bit of, if we just had a little more time to coordinate responses, because again, I don't think there was any malice in any of the responses. It was just trying to coordinate them across multiple and simultaneously that drew a number of challenges. And so we responded to the low-hanging fruit. We could get there quickly. We may not get there quickly, but I do think when it came to the rollout of vulnerable, you know, there was confusion, you know, as to when we talk about Aboriginal and Torres Strait Islander people and vulnerability and, you know, exposure to chronic and complex health conditions and things like that, that we're talking a population that, you know, isn't old in age-wise. And so when people were sort of putting age brackets to them, oh, well, that's not me, I don't have to worry. Whereas it's like, well, it is you because, you know, you've got diabetes or you're, you know, you've got other chronic and complex conditions that if, you know, you were exposed to COVID and then had to respond to it, your ability wouldn't be the same as any other 50-year-old, for example. So there was just a confusion about, and even the way we speak about, you know, chronic and complex conditions. What the hell does that mean? You know,
and what's a comorbidity and who has them? And like I've had other experts on the podcast that kind of say, well, if you're overweight, you've got a comorbidity. If you have any inflammation, you know, or skin conditions, your immune system is quite weak. Like, you know, they're kind of, there's probably not that many people who you can kind of generally say you're healthy, you know, but a lot of those comorbidities fit quite a number of people.
And I think that was it, was that, you know, we were trying to respond in a very particular way that went, well, you know, these are the set parameters.
Yes.
But if you were, I'm not sure, where did you go and ask? Because let's face it, sitting on the COVID hotline wasn't high on people's agenda of things I would really want to do.
No. And also there's, you know, lots of people think different things. Like there was a kind of scandal, you know, by one of the private schools here in Sydney who had accidentally, or, you know, who knows what happened, had vaccinated kind of some of their population, and this was back when the vaccine was scarce, and they're you know, so they'd vaccinated some of their 17 and 18-year-old boarders, but you know, I think what was kind of missing in that, and it was actually an opportunity, I think, because the school said, well, we approached New South Wales Health to say we have an Aboriginal population here in the boarding community, we want to get them vaccinated. And so that was the kind of context of that response. And then whatever, accidentally or on purpose, then, you know, non-Aboriginal young people got vaccinated. And what struck me, and I thought the question that people weren't really asking, was that was actually a really great response from the school, you know, to be kind of forefront to say, hey, let's vaccinate, you know, those of the Aboriginal population of our school who want to be vaccinated. I was kind of like, is that happening in public education? Shouldn't we be doing that with our Aboriginal students in Western Sydney, as you say, who were quite a high population? And it did kind of struck me that there wasn't the same coordinated, or there wasn't that kind of thinking happening around vaccination at that time amongst a lot of populations.
Well, probably agree, amongst a lot of populations. But the thing about, you know, what you just said then was there were also moments when we didn't know, you know, as I said, they were confined by age brackets, for example. And then, as you said, there was a level of, we'll be proactive and try and say, well, how do we ensure the safety and well-being of Aboriginal and Torres Strait Islander students that are boarding with us? But, you know, and I don't know, so I'm not.
I don't know either. But it was like,
speculate. But, you know, so I think on the one hand, there was that, as you say, very much, it came at a time where people were going, but what about other vulnerable groups? And, you know, if you're in a boarding environment, yes, it would go through rather quickly, but are you also a little more protected than somebody who's, you know, because you can control your variabilities a lot more in an environment like a boarding school and things, whereas out in the community, you know, the variability of who and where you might be in contact with people becomes a challenge. So I think the conversations that came out of that were, what was the intention? And like many Aboriginal and Torres Strait Islander things, intentions are always start really well, but that doesn't mean, you know, it didn't lead to hell for her. So it's saying, well, again, and trying to bring people on a journey to understand that what does it mean for you to be vaccinated? It's not just about you.
Yeah.
You know, as I said, you know, I've got young children here, and at the height of the pandemic, my mum was going through chemotherapy for cancer, and mum lives with us. So, you know, we're a intergenerational, 3-generational family household. And, you know, my kids' biggest fear was that they would kill their nan.
Yeah.
That they were going to school, you know, we would drop Nan to the cancer centre and she'd have to go in all on her own because they needed to control those variabilities and things. So, you know, experiencing that and then coming home and they're still going to school at this time, and it's like, but Mum, what if we bring COVID home? What if we kill Nan? You know, so it's those moments of we need to vaccinate our vulnerable, because if they do contract COVID, the chances at that time, you know, particularly if they were immune compromised, were vulnerable to, but they're probably not out and about in the communities, whereas the ones that are out and about, but, you know, we didn't have TGA approval and all of those sorts of things. So there was the chicken and the egg, or the horse and the cart type of scenario. We just didn't know what we didn't know. But in those moments, there were people and humans in our population that were struggling with, what does this mean? And it was more than just, what does this mean for me? What does this mean collectively? So I think they were the good learnings that we were able to go, okay, well, we actually can see that there is a bigger thought process. And when you spoke about, you know, some of the protests around, you know, you've taken away my freedoms, and as you said, you know, no, you still have a choice.
That's right.
You're still
you
making
just don't like
that
the consequence of your choice.
And whereas I think for others, as you say, you know, this notion of removal of freedoms and things like that has a very different nuanced environment, and you know, it is actually unpalatable at times to actually go, well, when you consider as a global community and learnings from, you know, Aboriginal and Torres Strait Islander and First Nations people around the world, which was, you do what's right for your community, you do what's right for the collective, because that's how we have survived. That's how we've understood what does it mean to be sustainable, not just within the environment, but actually part of it, you know, as a part of the living and breathing ecosystem that exists in the structures.
I'm just really struck by, you know, that picture of the intergenerational communities and how strong that connection and that relationship then grew to such a benefit, you know, like that was such a gift really. The vaccine response, that to have that kind of understanding at such a young age, your son to go, well, this isn't just about me and needing to go to school, this is actually about my nan and her wanting to be around.
And you know, they were the first, as soon as it was you know, Aboriginal and Torres Strait Islander kids as young as 12 could be vaccinated. It was like, Mum, can we go get vaccinated? Sure. You know, again, you know, it wasn't something that I had to sit there and have huge conversations about as, you know, the health professional, or the, you know, the good optics of what was it, what might it look like if, you know, you do. It was just, Mum, we want to have it done. There was no question. And I think that's what we're saying, you know, the media campaigns from Aboriginal and Torres Strait Islander communities about getting in and getting it done. But I do have to say there are still discrepancies. We're talking about a vaccination rate at the moment of, you know, we're hitting 90%, and that's not everywhere. And I remind people that it's a bit like saying, you know, I live in Coolaman. If you're with Optus, you don't get service here. So, you know, you've got to go with Telstra, for example. So it's the same, that we're going, well, you know, coverage isn't everywhere.
Yeah.
And when we say we've got this, it isn't everywhere. And, you know, the other part to it was prior to, I suppose, our local pharmacy in conjunction with the GP and things like that, really having a concerted effort that you go, okay, people didn't want to drive into Wagga to get vaccinated.
Yeah.
You know, or they didn't want to go to another town that had COVID because we didn't have COVID.
Yeah.
So, and again, you know, how do you do it?
Yeah.
And I think, you know, Wilcannia in New South Wales was the classic example of we really need to take things to people. We can't rely on people getting to the vaccine. And that's on a variety of reasons. The equity of even being able to afford to get to a large city to get your vaccination is, you know, something that not all Australians consider, you know, that do I have the finances to invest in a car trip that's going to take me a couple of 100 Ks away from home, and A, what happens if something breaks down, or B, do I need to stay overnight just in case so that I can feel secure if something does happen? And so, you know, you've got all of these other considerations that you just go, when you have access to, you know, the services, you tend not to think of all of those other bits. And, you know, as a community pharmacist, I have to say I was so happy to see the participation of community pharmacy. And, you know, in Western Sydney, you know, talking to some of the community pharmacists there, and, you know, the fact that they had staff that could speak up to 9 different languages of, you know, what was happening in community, that they could respond to questions. They could, you know, be able to have access, and you saw that vaccination rate soar. And I think they're the sorts of things that we need to say, which is, what are the strengths of our communities? When they tell us these are things that could work for us, we've got to listen.
Yeah, that's right. And I was also just thinking about, when you're talking about access and vaccination as well, about the efficacy of the vaccine, and has there been, do you know, like, has there been any, is there any discrepancy between the efficacy of the vaccine with Aboriginal populations and with
it's probably not data that we do actually have readily available, because we're already talking booster shots, and let's face it, the efficacy of vaccines aren't being pushed to their limits because we don't actually want to push it to the limits to see what they are. So trying to go, okay, well, is there a lower efficacy rate at this point? I think, you know, there hasn't been research really done on that. Because part of that is, from a scientific point of view, yes, we would like to know, but from a human point of view, we just want people to be covered. We just want people. And and so that's why, you know, the booster shots are being recommended from 6 months on for vulnerable populations, because we don't even want to see, you know, we're going, oh, well, we're starting to see a decline potentially around 6 months. We don't want to know at what points does it actually become critical that, you know, you've almost lost whatever coverage that you had against it. So I think that's where we're currently sitting at the moment. And as we go through and look at the frequency that boosters may be required as we go along, that they're things that can be considered. But I think at the moment,
get your booster.
Get your booster.
And this has been such a great conversation, but we can't go. I wanted you to talk about Uncle Charlie. I was looking at that incredible picture on your wall, and then you told me about your business. So tell us, it's amazing. Christmas gifts for all.
Christmas gifts for all. So come from a small country town called Trengi in central west of New South Wales. Slightly less than 1,000 people live in the town. And whilst I don't live there, that's still our home. That's still where we are. But Uncle Charlie was my mum's uncle. And so we wanted to honour his story. And he was a drover. And so he would often bring tastes of country back home to us when he would go around. And so one of the things that we thought we could do to honour that is we've started a company called Uncle Charlie's Tastes of Country. It's 100% Aboriginal owned. All ingredients are all Australian grown, 100% Aboriginal and Torres Strait Islander botanicals. You know, we buy direct from communities. We understand where every ingredient comes from. You know, we've been exceptionally mindful about making sure we're authentic and telling the story through Uncle Charlie's perspective, you know, and trying to engage. So the packaging, I'm just going to
go get it. Show us. It's amazing.
So anyway, you know, each one a different unique flavour of engaging, being in a relationship with Aboriginal and Torres Strait Islander people, but understanding what does it mean. So, you know, it comes, but we're really proud that there's no glue, you know, so when we talk about taking care of country, we don't put back anything into the country that's going to hurt it, and that, you know, people can use these as gifts, you know, but it's got artwork that tells you where it comes from. There's embossed weaving into the box, and when you open it, you can share it. A coolaman in our language is holding, a dish for holding. So we've created a coolaman that you can pop your popcorn in, share it with friends, colleagues, family, and then, you know, keep this and really just understand, but like QR codes will take you to the communities in which you've got your native ingredients from. We're using macadamia oil rather than canola. So 100% vegetarian, vegan, gluten-free, dairy-free. So, you know, there is no reason why you can't share with family and look at being in relationships with Aboriginal and Torres Strait Islander nations.
Amazing. Well, watch out, my friends, because I've found my Christmas gifts for this year, that's for sure.
Uncle Charlie's Tastes of Country.
Excellent. That's so great. So thank you so much for coming. It was just such a great conversation. Thank you so much, Faye. It's been great to meet you, and thank you.
Thanks, Jo. I appreciate the opportunity to yarn with you, and I do hope that everybody is safe on the countries in which you will watch or listen to this podcast, and that we are all on an Aboriginal or Torres Strait Islander nation. And so when we listen, reflect on who's the traditional custodians of your lands and pay respect to the continued connection and significant contribution that Aboriginal and Torres Strait Islander people make to this country.
Yeah, amazing. Thank you so much, Faye. This has been another episode of Teaching Heroes, and I've recorded this on Darug country. So thank you all, and I'll see you all next week. Okay, bye.